Hi, everyone. Welcome to the Harmony Foundation podcast series. And I'm pleased today to be joined with Austin Johnson and Caroline Bunn with Summitstone Health. Welcome.
Hi.
Hi. It's good to have you both here. I'm really excited that you're on campus today. We're interested in, of course, and you know, on a beautiful day too. I mean, Sunday we had lots of snow and people still tried to brave the elements to come up. So it's nice that you guys did that, which is good.
Yes, and my little Prius too.
That would have been fun. That would have been fun. You know, those cars, they're hardy cars. I mean, you probably could make it work.
Yeah.
So before we get into the specifics about Summitstone, we'd love to get a little background on both of you first, just talking a little bit about how you got into the field. And so, Austin, let's start with you first. So what kind of put you in the field of working with addiction?
So, I mean, I have a long history of addiction within my family, and then I struggled with addiction for a long time. So, in January, I'll be celebrating my 9th year.
Nice.
So,
good job.
Yeah, so when I, initially got clean and sober, I really wanted to work with people that, struggled with some of the things that I struggled with, and in a field that, I knew a lot about, but didn't necessarily have the education. And then I went back to school and got my bachelor's in social work with a minor in criminology. So this is a field that I hold near and dear to my heart, because I truly believe that there's hope and there's recovery, and that, there's different ways to establish that. So
Nice. Thank you for sharing that. And how about you, Caroline?
Yeah, I have a slightly different path. So when I was in my bachelor's, I really thought I was going to be a teacher. And then it turned out that I wasn't all that great at classroom management. And but what I also realized is that, like, I would see these kids within a class of 30 where there were, always at least 1 or 2, maybe 3 or 4 kids who really seemed to be struggling more than other kids in the classroom. And I felt really drawn to help those few children, because they very clearly were not getting what they needed in that larger environment. So I really went to grad school thinking I was going to be a school counselor, and then got pulled to the more community health end of things. So my background is in working with kids recovering from trauma, and then have done a number of other things, like working in hospital settings and schools, and then made the jump out of clinical work to do outreach for Summitstone about 2 months ago, and it's been a really fun and really great fit.
Yeah, I mean, I really see, the work that you're doing and what a lot of other people do as well, as far as being ambassadors and helping usher people to the right place, is vital. Yeah. I mean, there's a valuable role in everybody playing and working within the behavioral health space. And so, well, thank you both for the work that you do in this field, because it's not easy work. Oh. So we appreciate that. So let's talk a little bit about Summitstone Health Partners. It's got 50 years of service, almost similar to Harmony. We're celebrating our 50 years, yes. So I think we're almost, I don't know, when did you guys open? Do you remember specifically? I wonder who's older.
We're older.
You're older?
We just celebrated.
We're looking good, though.
Okay.
We're over 60 years.
Over 60?
Yeah.
Oh, okay.
Yeah.
Over 60. Well, then you definitely are. I don't know where I got the 50 from, but that's great.
I think it's over 50 services. So there are a number of different numbers. We've all of our offices, and then all of the, we're in over 24 offices.
We did celebrate our 60 year.
So 60 years with 50 services.
Over 50 services.
Yeah, and you treat people with substance use and mental health disorders.
Yes.
You're actually the largest behavioral health provider of Medicaid in Larimer County, which is really impressive. What do you think sets your program apart from other programs?
I mean, we really do. We really do provide. When you say 50, I mean, I imagine there's probably more services than 50, but we just really try to fit the needs of the individual client that walks in our door. From the moment that they come in for their intake, we are trying to fit their needs, whether they're here for mental health services or they're for substance use disorder, or both. So we're really trying to facilitate all the needs of this client, while because their financial, I don't know how to explain that, but
Well, I'll jump in there. I mean, what I really love is that we treat people across the lifespan. So we have a really robust early childhood program where we go into daycare settings and support in that way, and then also offer parenting classes for parents with kids as young as a few months old, all the way up to older adults who are struggling with their with whatever it is in their life that they're struggling with. And then also, you know, what I think is amazing is that not only do we have our different offices throughout the county, but we're in the jail. We're in several different community health care clinics. We are in 4 different schools in the Thompson School District. I mean, we are really meeting people where they're at, just across the county, no matter where that is.
And it sounds like hitting every demographic as
Yeah.
well,
Yes.
which is really, you know, not normal. Most people are very specific to one audience, and it sounds like you all are really making yourselves available to everybody across the spectrum, which is terrific.
Yes.
So one thing, I feel like I'd be remiss if we didn't talk a little bit about your new position as MAT administrator. Can you talk a little bit about what that means and what people would get from that if they were to come through your program?
Yeah, so our program, we have a medication-assisted therapy, which we treat opiate use disorder and alcohol use disorder with those medications. And we've been doing that for the past 2 years, is when we started our Suboxone program in Loveland, and then our Vivitrol programs are both in Fort Collins and Loveland. And so really with this new position, the grant administrator, we're looking to expand our services to our Fort Collins area, and also we are expanding our services to a jail-based pilot, so that when people come into the jail, they are either being, you know, continued their MAT services, or they are being induced within the walls. So then they, you know, when they leave, when they are released, they are connected with services, whether it's with Summitstone or with other agencies. We're making sure that they're connected and hopefully definitely reducing overdoses and reducing recidivism.
That's
so it's a big deal for us, and you know, we're really proud of the work that we're doing right now with the MAT work.
Yeah, we're really fortunate to have that grant, because I think communities across the country need it. I mean, we're all facing this opiate crisis, and so it's really important to have that.
Yes,
Absolutely.
So, Caroline,
Yes.
what purchase of $100 or less has most positively impacted your life in the last 6 months?
I'm going to go with my dog, and we actually got him for free because he was abandoned.
That is a
with
great
us.
price.
Yes.
So tell us about that. Who's your dog?
Yeah, so we, you know, he came out of a tough situation. It was a couple that was divorcing, and nobody could agree to keep the dog, and it was actually at a dinner party. My husband and I met him, and it's funny because I'm more the dog person in our dynamic, and my husband Ryan walked in and saw this dog, and I'm surprised that we didn't leave with him that night. And so now we have a 105-pound St. Bernard / German Shorthair Pointer mix, and that's why I'm covered in dog hair 99.9% of the time.
That is, I mean, that's a gift
and
that
Austin
keeps on
because she was in
giving.
my car. Yes, absolutely. So that
fantastic.
is the best purchase under $100. Probably the best purchase, period.
Yeah, that's great. Well, congratulations on being a pet owner.
Thank you.
So, and then for you, Austin, if I were to play off the idea of the word harmony, what do you think it means to live a life in harmony?
I mean, that's a very large question, I think. But I think that, you know, being able to live in an environment where, you know, you have community support and you have family support, and you just have this cohesive environment that supports a healthy living style. I don't know, that's... When I come up here, I feel like this place is harmony to me. I mean, if I were to, you know, it's a breath of fresh air, and being able to just, you know, take in, I don't know, positivity. That's a hard question.
Well, I think it's being at peace, like being at peace with yourself, being at peace with the world around you, and you know, because I mean, we live in a really chaotic world and you know, not being pulled into
Right.
that chaos and being able to be just have some calm somewhere.
Great answer.
The
Both of
calm
you.
within the storm.
Yes.
I think that's a hard place to be at a lot of times, especially with, you know, working all the time, our families, and just being able to just be, just be. And so I think that's my idea of harmony.
Yeah.
Good answer. Thank you for that.
I remember one time when I was working with kids, I said to the 7-year-old, like, how do you know when you're going to be done with therapy? Like, how will you know when we're done? And she's like, when I don't have problems anymore. I'm like, well, that sounds great. But that's not going to happen. And so I think where harmony comes in is like being able to weather those storms of, because we're not going to stop having problems. We're not going to stop having whatever comes up. And, you know, being able to be at peace or being able to have some sort of...
And move through that with grace.
Yes.
Wonderful. Thank you for that. And so, Caroline, if someone wanted to access services at Summitstone, how could they get in touch with you?
There are a lot of different ways for people to access services. So the best first step is to call our primary line, and that is 970-494-4200. That's going to be a great number to get connected with services. It's also the number to reach for crisis services. So we also house the Larimer County, or the Crisis Center for Larimer County, and that's at 1217 Riverside Avenue in Fort Collins. And anybody can walk in there 24 hours a day, 365 days a year to get support with a mental health or substance use crisis. But they can also call the 970-494-4200 number to get connected with somebody there as well. And then we also have walk-in services Monday through Thursday at our Bristol Cone and Wilson offices. So that's in Fort Collins and Loveland.
Great. So you're making it very accessible for folks, which is what they need. So
absolutely.
Really appreciate it. Well, both of you, thank you so much for taking the time to come up for the day. It's a real pleasure to meet both of you, and we look forward to sharing Summitstone's work with the world, and looking forward to continued partnership. Thank you.
Thanks for having us.
Yeah, it's fun.